I'm working on mediKanren with you and your students.
Hi, Kat. What's up?
Hi, Nada. I'm currently running a program that we wrote that's meant to rank the efficacy of certain drugs in treating certain diseases and also rank their side effects.
Oh, cool. How does it work?
Well, for each disease, we look at any drugs that are related to it or may affect the genes either by upregulating or downregulating some part of the disease. And then those drugs are also associated with side effects. And even though it's a fairly crude ranking right now, because it only factors in the number of side effects rather than the severity of them, it ranks the drugs that are related to the disease by the number of side effects that they cause, with the least number of side effects being the top ranking. Because in general, you want a drug to not have any kind of off-target effects when trying to treat a certain disease.
That's interesting. So if I understand you, you're making sure that if a disease, if a drug exasperates the side effects of a disease, then it's not a good drug for that
Yeah.
disease. And in order to do that, you're writing queries on this knowledge graph. Can you give an example of what the two treats do, for example? Hey, Matt White.
Hey, how's it going?
Good, how are you?
I'm good. Well then, quick introduction. I'm Matt White. I'm the director of the Precision Medicine Institute at UAB. I'm also a senior lecturer in biomedical informatics at the Harvard Med School. And I'm one of the originators, along with Will Byrd, of mediKanren. And mediKanren it's a general purpose reasoning platform for biomedical knowledge, but we use it very specifically to identify drugs that could hit specific molecular targets. We began with rare diseases. We're graduating up to cancer and have done a lot of work since January on repurposing drugs for COVID, even to the point of launching a clinical trial of a potential treatment with the national VA.
Wonderful, thank you very much. And we're all very fortunate to be working with the Precision Medicine Institute that you're running.
Well, likewise.
Hey, Kat, can you show us what's happening with our query?
Yeah, sure. So it actually just finished running and you can see the results. So this is the result of the run of the query. And as Marissa mentioned before, it gives you a list of the drugs ranked based on the side effects that they have, whether they're exacerbating a patient's conditions or exacerbating the phenotypes of a given disease. And so you can see this long list of drugs based on their rankings here.
That's great. What is the top ranking drug? What does it stand for?
So this is the top ranking one right here.
Can we get the full name for it? Yeah. So that's okay. So it's an anti-hemophilic factor, which makes sense because the disease that we were looking at for this example was hemophilia.
So the following is a knowledge graph that represents all of the data sources that the mediKanren project has acquired through the NCATS consortium.